Brendan, thanks so much for chatting with me today about what it's like to be a resident doctor. Let's get started. Did you always want to be a doctor?
So I didn't realize that I wanted to become a doctor and go to medical school until I was about halfway through my training, my undergraduate degree in the Faculty of Health at University of Waterloo. At that point, I realized that I wanted to be able to both have an impact on an individual's health in a family medicine kind of setting, as well as being able to have an impact on the health of our populations overall by pursuing residency training in public health and preventive medicine.
Your biggest learning so far as a resident doctor?
My biggest learning so far as a resident doctor has really been the importance of communities. And that has been communities that are working to protect and improve the health of each other within that community, and as well as communities within the healthcare system, and the importance of working with others within the healthcare system to really be able to achieve everyone's maximum health potential.
What's a or the top skill you think a doctor needs?
The top skill that I would say that a doctor needs is perspective, and I think that perspective really is informed by humility. We have such a good understanding that the majority of our health is not determined by our innate biology or genetics. It's really determined by the circumstances that we were born into. That's our families, our education, our socioeconomic status, and our access to things like housing and food and water. And so having an understanding of some of the broad factors in our society that will impact those determinants of our health is really critical to being able to understand how can we improve health of individuals and populations and really move the needle on making sure that everyone's able to achieve their maximum health potential.
Best thing about being a resident doctor?
The best thing about being a resident doctor is really being able to go to work every day and to be able to work with such an amazing team of people. And in family medicine, that might be clinical staff, might be nurses, pharmacists, social workers, but in the public health world, that could be public health nurses, public health inspectors, and really having the opportunity to work with the community broadly to make a difference on health issues that are really affecting larger sections of the population and many people overall. And so having that variety is really the best thing about working as a resident doctor and having the opportunity to work with all those different people.
What's a hard truth you want to share with someone interested in becoming a doctor?
What I would say is the hard truth that I would want to share with people is that medicine is not necessarily the best way to achieve every single person's career goals. There's such a diverse set of careers within healthcare as well as public health that really can meet the needs of people looking to pursue those fields, and that could include things like pursuing epidemiology and or public health nursing or skills in health promotion, and those things are really critical to the practice of public health. Or it may be that if you're interested in the healthcare sphere, different professions such as pharmacy or optometry or nursing might be things that really meet your needs and career goals better. And so I always really encourage people to think very critically and hard about what it is about medicine that makes that the path that they want to pursue, and what would some other potential routes be to find a career that they're going to be really passionate about and be able to make a difference in.
One tip for students who want to get into med school?
My biggest tip that I always give to students looking to get into medicine is really find that thing that you're passionate about and really commit your time and effort to investing in that passion. Whether that is something like getting involved in the community, whether it's volunteering or being part of causes and rallies for social justice, whether that's things like research and getting involved in academia or advocacy and things like student government on campus. These are all things that are really going to build skills that are really critical in pursuing any career where you have to work with other people, as well as really give you some of those soft skills and that you might not be getting through your coursework. And so finding that thing that you're passionate about and really committing time and effort to it is going to serve you really well in the long run, no matter what career path you end up deciding to take.
And that's it, Brendan. Thank you so much.
Thank you.